So the next topic will be on teleconsultation, and we have got a very young, talented, dynamic resource person, Dr. S.P. Karamath, to talk on teleconsultation. As you all know, during this COVID time, many of us have been using this form of consultation, teleconsultation, which was very useful for most of the pediatricians, especially in the cities. We had a talk on this by Dr. Somasundaram. It was very excellent, and many of us started trying that. It was useful. So I think today we have got an excellent speaker, Dr. Karamath, who has finished his UG from Stanley and postgraduate from Stanley. He's now working as a senior assistant professor of pediatrics at ICH, and he's a winner of Kandusamy Memorial Award in Pharmacology and IAP Professor JV Memorial Gold in Pediatrics. He's looking after general pediatrics at ICH and endocrinology. His interest in vaccinology and endocrinology, nutrition, and more important about him is he's very active in the social media platform. He has a separate YouTube channel, that is the Tamil Doctor, where he has got about 175 videos in Tamil with 55,000 subscribers and more than 1 million views. So this is a very, very important aspect of Dr. Karamath, which many of us may not find time to do this. Definitely, he is creating a lot of things in the social media platform and lifting the image of a pediatrician. So over to you, Dr. Karamath, for your topic on teleconsultation.
Thank you, sir. Thanks for the nice words of introduction, sir. First of all, I would like to thank IAP State Office Bearers, President Aram Sindil sir, Suresh Balan sir, Rajendran sir, for allowing me to present this topic in front of the August audience. I would like to start with the disclaimer that these slides were originally prepared by Dr. Somasundaram sir. In fact, I have modified it slightly with his permission. Anyway, we have all now been using teleconsultation in these periods of COVID. No, a doctor has moved from this to now this. So he is now available on call at all times, probably. But we all had our doubts, especially after the July 2018 Maharashtra Bombay High Court judgment that telephonic consultation amounts to culpable negligence.
In fact, share your screen, please.
Sorry. Just a minute, sir. Oh. So doctor has moved from this to this, a doctor on call.
Still not
we
shared.
had this.
Still not shared.
Sorry, sir.
Karamath, you can share your screen, boss.
Share put over something.
Tirumurugan is sharing your slides.
I think one participant can share at a time. Just a minute, sir.
இல்ல அவர் கொடுத்துட்டாரா சார் உங்களுக்கு?
இல்ல கொடுத்துங்க சார். Nobody else is sharing.
Okay.
ஸ்லைட்ஸ் வேணுமா சார்? ஸ்லைட்ஸ் போடணுமா?
இருக்கு சார், என்கிட்ட இருக்கு. இப்போ வருதா சார்?
இல்ல வரலீங்களே.
என்னால ஷேர் பண்ண முடியல சார்.
அப்படியே எனக்கு வாட்ஸ்அப்ல அனுப்புறீங்களா?
சார் என்கிட்ட இருக்கு ஸ்லைட்ஸ்.
இல்ல சோமசுந்தரம், if you are having, can you share the
Yeah, I have sir.
Karamath sir, Soma is sharing the screen.
கொஞ்சோண்டு சேஞ்ச் பண்ணிருக்கேன், அதனால தான் பார்த்தேன் சார்.
இல்ல நீங்க ட்ரை பண்ணுங்க, இல்லனா நான் ட்ரை போடுறேன்.
இல்ல கராமத், நீங்க எனக்கு அப்படியே ஷேர் பண்ணுங்களா? எனக்கு மெசேஜ் அனுப்பிச்சு விடுங்க, ஃபைல் அனுப்பிச்சு விடுங்க.
அப்படினா கூட ஓகே. அவரோட ஸ்லைட்ஸ்க்கே பேசிடலாம். யா
ஓகே சார்.
சேஞ்ச் பண்ணிருக்கீங்க, நான் அதே மாத்திருங்க.
அனுப்பிச்சிட்டீங்களா?
இதோ அனுப்பிட்டே இருக்கேன் சார். இப்போ வந்துருச்சா சார்?
வந்துருச்சு
வந்துருச்சுயா.
ஓகே ஓகே. Sorry sir, sorry about that. So a doctor has moved from this to now this. So we have now moved to an online doctor, a doctor on call, practically available every day. But we had our doubts. Prior to this legislation came into being, we had the famous or infamous Bombay High Court verdict where there were issues, prescription without diagnosis would amount to culpable negligence. We had Karnataka Medical Council warning doctor against online consultation. This was a gray area. In fact, we had done a CME in IAP Chennai City branch, technology for office practice. So where we did speak regarding online consultations, but where we envisaged that this would be a future. Just in December of 2019, we said this is the future, it is going to take up. And once COVID came, telemedicine, once a hard sell, now became a booming demand. What is the definition of telemedicine? This is the definition of telemedicine as given both in the current law as well as by WHO. The delivery of healthcare services where distance is the critical factor. So any healthcare professional can provide telemedicine as per their expertise where distance is the critical factor. And we also have a definition for telehealth. The essential difference between these two is telemedicine deals with consultation, that is online consultation. Telehealth includes other platforms like what you are doing for educational purposes or for radiology. So those things constitute telehealth. Telemedicine is explicitly like online consultation. Advantages of telemedicine are very obvious. It is timely, it is faster, it has wider access. So even when Chennai has many number of pediatricians, the patient from you goes to a remote place where there is no access, still they can call you for consultation. And once this COVID started rising, we had a 500% rise in healthcare teleconsultation, and 80% of them obviously because this was new or first time users. And 70% of patients do teleconsultation with known doctors. That's why every one of us should start doing teleconsultation. Teleconsultation is here to stay. Even the COVID fears, if they are gone, still the patients would like to consult with you even when they are not in your hometown. Telemedicine market is going to reach dizzy heights. This is the flow of my talk. What is the need for teleconsultation? What are the benefits? What are the guidelines provided by the government of India? What are the modes available? What are the ways how to manage, and what are the steps as given by IAP? This talk will obviously be useful for all of us. Those who have already started clinic, they can also start teleconsultation. In addition to that, because teleconsultation will be, in my opinion, at least 20 to 25% of practice in future. Those who still have not started their practice, worried about apps, worried about platforms, they can also use it by very simple means with just their smartphone alone. So this is how it is going to go. So telemedicine in the times of coronavirus. Coronavirus is obviously an occupational risk. For others, it is just a public health hazard, so we need to stay safe. But for doctors, our occupation is inherently risky. So we are going to go through this not only during COVID-19, even when some other virus is going to emerge, any other emerging disease, we are always having this occupational hazard. So we can't say no to patients. The real achievement for a doctor during this pandemic is to lead a life with no financial deficit, with obviously no increased risk of corona infection. Can we do that? Telemedicine forms an important part for that. It is obviously a balance between life and livelihood. For the doctor, this obviously has monetary benefits, and most importantly, you can hold on to your patients. If you are shutting down your clinic for months together, or if you are running your clinic with a limited time and limited clientele, if you have fever, you are not supposed to come to my clinic, that doesn't work. The patient is going to go away. But if you are having a teleconsultation, you can hold on to your patient. And for the patient, the biggest advantage is consulting the routine doctor. We all know there are patients who switch at the drop of a hat, but there are patients no, in spite of no you not being available for 4 days, 5 days, the 6th day, once you open your clinic, they come back to you with 2 or 3 prescriptions from different doctors because they want to consult you. They consider you as your primary care physician. So they can do at the ease from their home without risk of no increased risk of contracting diseases. They can also consult their routine doctor. So this provides patient safety as well as health worker safety. Obviously, with digitalization, there is a higher likelihood of maintenance of records and documentation. Hence, whenever you are having records, it offers legal protection to us. It obviously saves cost and effort for travel, both for the doctor as well as for the patient. As I said, it has faster access and access to services that may otherwise not be available. So a dermatologist not available in her place, but they can consult over teleconsultation to know wherever they are not practicing. Even in cities like us, now patients want ease of access. So they want just to know walk to their doctor. If that is not available, they are not ready to go out. So in that times, teleconsultation becomes a boon. Obviously, it reduces the burden on the tertiary and the secondary hospitals, especially during these times, and it provides equal access. Anybody with a smartphone can access to quality care at all times. And obviously, patients also will stick on to appointment timing. So when you fix an appointment at the appropriate time. So with all this in mind, previously there was a gray area about teleconsultation, but Government of India came into this guidelines about teleconsultation. They were notified, they were gazetted telemedicine practice guidelines of 2020 in 29th March. So the essential gist is physical assessment and physical consultation. Though it is desirable, it is the best form of consultation. It is not mandatory. Telemedicine is now completely legal. Doctors can consult, message, prescribe on phone, which we are doing with pressure. Patients tend to ask for medicines over text messages, over calls, over WhatsApp. That is now legal. With this, the legal provision, legal protection to doctors has come under the section, the Epidemic Disease Act 1896. No legal proceedings can be taken against persons who are acting in good faith. So there are various modes of consult. It can be over telephone. It can be over these social medias like WhatsApp or Skype. It can be through email or text message. It can be through dedicated apps. No, I am not mentioning. There are few apps mentioned, but there are plethora of apps. So you can see it is a booming industry. So everybody wants to cash in. So there are umpteen number of apps through which you can do this teleconsultation. What are the basic modes of teleconsultation? The foremost or the first is the video consultation, because it is considered closest to a real physical consultation, because here you are seeing the patient. So you are seeing the patient, you are seeing the response, you are seeing the facial response. So you can assess better, much better than other forms of consultation. So a video teleconsultation is considered superior and distinctive when compared to other forms of consultation. A video consultation can be over video on chat platforms like Skype, WhatsApp, FaceTime, and through dedicated apps. Like Karthik was saying about the clinic management softwares, many of these are also have integrated teleconsultation apps too. So you can do those through those things, or through audio, through a regular phone call, or voice over internet, that is WhatsApp phone call. Instead of WhatsApp video call, WhatsApp phone call, or apps again, or a text based. Text based is normal text, WhatsApp text, Facebook Messenger, through internet boards, through anything. All these are synchronous. That is, patient and the doctor are simultaneously on the platform at the same time. So he is asking a query, you are answering via text or via phone or via video, but that is synchronously happening. Teleconsultation can also happen asynchronously, where they can send an email or a fax or a recorded voice where you are answering or consulting for them at a different time, not at the same time. Probably at night you have 3 email messages requiring teleconsultation, you are answering them in your professional capacity. So there can be asynchronous too. Coming to the type of consult, essentially as per this law, teleconsultation is divided into two. One is the first consult or a follow-up consult. The first consult is whenever patient consults you on the first time, for the first time, or the patient has consulted you, but for a different problem. Now he has come to you for a different condition, or for the same condition, the patient has consulted you, but a time period of 6 months has elapsed in between. So all these situations, it is called a first consult. When a patient has consulted you within the last 6 months and the follow-up is after a month, you say, then it is called a follow-up consult. It is for the same condition within 6 months. So different conditions, first consult, or more than 6 months, you call it as a first consult. Consent, as for any other act, consent is essential, consent is important, but as for consultation, as for physical consultation, when they come into the room, asking for your consult, when they have paid their fees, that implies consent. Here also, it is not implied, it is implied. You don't need to have an explicit consultation. So if the patient has initiated the call, if the patient has initiated the consultation booking, an appointment, then the consult is obviously implied. What about the fees? Obviously, our money, our time and your brain is worthwhile. So it is absolutely fine, proper for you to get a fees for your teleconsultation. So it should be treated just like in-person consultations. You may charge an appropriate fee, which might be lower, which might be higher, but it should be appropriate. You can't charge an exorbitant fee. The law simply says you may charge an appropriate fee for the telemedicine consultation. And if they should also give, we should also be ready to give a receipt or an invoice for the fee charge for the teleconsultation. How to manage, that is how to treat the patient for teleconsultation. It is not necessary that you prescribe a prescription. For that alone, you are charging a fee. It can be simply a patient education. So you are saying about ORS, you are saying about rehydration, you are saying about avoiding dehydration. This health education is a form of consultation. Counseling. So patient has an hearing aid, or patient has doubts regarding vaccination chart, patient has regarding different types of vaccination. You are counseling them. That also forms the part of consultation. For that also you can charge a fee. And obviously the third form is prescription, what we routinely do. That's what we traditionally tend to take it in mind, that I have to charge a fee only when I prescribe medicine. It's not so. All these are forms of consultation, whether it is for education, counseling, or for prescriptions. And based on this, the law defines medicine into three groups: OAB. O is OTC, over-the-counter prescriptions like paracetamol, ORS, zinc, vitamin D, or multivitamins, or cough preparations. So these are list O groups. So you can prescribe this via any mode of consultation, whether it is video, audio, text, first, follow-up, any method, any mode of consultation, you can prescribe these list O medicines. There is no hindrance. List A medicines are those medicines which are to be consulted in the first consult through video, or when it is a follow-up consult, that is within 6 months for the same problem you are following up, you can prescribe those medicines. These are called list A medicines. List B is some other medicines which can be given via follow-up. So what is explicitly mentioned in the act is, like if you are prescribing an hypertensive medication, it is not under control, you are adding some medication more. So that is a follow-up medicine, list B medicine. So for that, you need not have a video consultation. For a first consultation, to prescribe a list A medicine, it is essential to have a video consultation. If it is not video, it is okay to prescribe list O, that is OTC preparations, or if it is a follow-up consult, you can prescribe list B. You can't prescribe, obviously, medicines which are classified under Narcotics Act through teleconsultation. And how to handle emergency situations? Obviously, when you say I am available online, you are going to face with emergency situations. You can always advise first aid, you can counsel, and you can facilitate the referral. So for such problem, so which hospital or which doctor would be best? You can initiate a referral. And what if the doctor doesn't wish to take that call? It is an odd time of the night. So the registered medical practitioner has the liberty to attend a teleconsultation request made by the patient. It is not that you have to attend at all times through 24 hours WhatsApp calls of the patient because you have mentioned I'm available for teleconsultation. So you can have your own time. You can fix up the timing for teleconsultation also. Just as you have mentioned prescribed timing in your prescription booklet for your physical consultation, you can also have teleconsultation appointment timings. You need not you need not be forced to attend teleconsultation request at other times or odd times. So this obviously is happening to us in-house consultation. This will also happen to you through teleconsultation. You can absolutely reject to provide teleconsultation, and even during the duty hours, it is your right to reject, especially if you can't consult over online. This condition cannot be diagnosed and treated online. So I'm refusing to treat you further. You need to in person visit myself or other doctor or hospital. You can do that at any time. So you can terminate your teleconsultation at any point of time with obviously information to the patient that you are terminating this because this has to be attended to in person. So that right is still with us. So it is absolutely okay. Now many of us feel once you start giving consultation over phone, this will be a hassle. That is not going to be the case. But as per this law, within 3 years, this was initiated during the pandemic time. So for now, this is the law. Within 3 years, you need not have any more certification program. But within 3 years, there will be an online program developed and made available by the Board of Governors, which was present at that time in supervision of Medical Council of India. So now NMC will probably prescribe an online program. All registered medical practitioners intending to provide teleconsultation. So if you want to continue teleconsultation, needs to complete this mandatory online course. This again will be an online course as per the law within 3 years of its notification. Right now, there is still this online program has not been developed. Once it is ready, we have to undergo an online course, which will obviously be simple and easy to understand. We have to finish that to continue doing teleconsultation. What are the limitations and drawbacks? Like any other form of technology, you will have problems and limitations. If you are not able to do teleconsultation, okay, delay, don't accept the call, delay. Sickness in children like dehydration, shock, where you need physically assessing the child, they can be missed. So it is better if you suspect some sick child or you want to physically check the child, you have to terminate the teleconsultation, informing the patient, and you are supposed to advise the patient to reach the doctor or the hospital. If the children needs admission for day 5, day 6 fever, you should assist them in securing this admission. So I have gone to the IAP, which they provided telemedicine practice in 6 easy steps. For this, you don't require much of equipment. So what do you need? You need to set up a WhatsApp business and Paytm for business. And Paytm for business is not required. So you can have now Google Pay or the Phone Pay, whatever account, that is enough. Need not be have a Paytm for business account. Still you can start your teleconsultation. WhatsApp for business, for managing consultations and appointments, it is better to have a WhatsApp for business account. Share your consultation hours with your patient. The patient takes an appointment. You send the payment procedure to them, a Google Pay link. They pay over phone, and then you initiate the video consultation, and then you prescribe. So why WhatsApp and Paytm? Paytm is just for IAP. They collaborated with Paytm. You can very well do even with the Google Pay. Why WhatsApp for business? The same phone number cannot be used to operate a regular WhatsApp and WhatsApp for business. So if your consultation WhatsApp is confused with your regular WhatsApp, where you have hundreds of unseen messages, you may not be able to operate both. So that's why it is better to have 2 WhatsApp accounts. Once you are ready with the accounts, that is a Google Pay account or a Paytm account and a WhatsApp for business account, you can share with your patients who are already who do have your phone numbers. You can share the that you are ready for consultation, mentioning the teleclinic details and the consultation hours. Okay, a simple message you can share over WhatsApp for business. That is the advantage of again having a WhatsApp business. You can just broadcast all the patients whom you have stored, and patient can take an appointment via phone call, SMS, WhatsApp for business. They can just take an appointment, and the doctor sends the QR code. That is the QR code for payment link, whether it is a Paytm or a Google payment. It's very easy to set up. So you can send a QR code so that they can pay the necessary payment. Once the payment is received, so you can start the WhatsApp business and you can initiate a video call. So because video is considered superior to other forms of consultation, it is better to initiate a video consultation. You can consult, end the video chat, and once the video chat is finished, you can write in your regular prescription pad and take a photograph and share it through the WhatsApp business to the patient. You can just send it through to the patient with the regular prescription pad itself. So what is required is just your phone. If you have a recent mobile with 2 SIMs, 2 numbers, you can have 2 WhatsApp accounts, one WhatsApp business and a regular your WhatsApp regular account. This itself will be enough. If you have a slightly older phone or you can't have 2 WhatsApp accounts in the same phone, then you need to have a separate phone for WhatsApp business. That's it. So that's how you send. This is the patient, with the Dr. Somasundram's permission, I am sharing this. So it is as simple as right click and send. So what you need is the 2 mobile numbers. If you can use it in the same phone also, you can do that. If otherwise, you may require 2 phones, a smartphone with Google Pay, Paytm or WhatsApp business, and a prescription pad, which all of us have. So without anything in investment, you can start a teleconsultation. Again, what you need to mention specifically in the prescription patient number, it is better to have an online patient number, whether it is an initial or a follow-up consult, date of birth so that the age is recorded appropriately, the weight, preferably write in capitals. Here what I've used through an app, so that comes in printed format, there is no issue. Use generic names or at least provide alternate names for medicine. Always it is better, because we are doing it through a digital way where it is recorded. It is preferable to use generic names or alternate brand names, and write always the instructions and when to review. So all those things it is mentioned to explicitly mention. So I acknowledge Dr. Somasundram, who has generously provided me these slides where I have made some changes. And seniors might think it's too late, technology is not for us. So it's not like that. It is very easy. As I said, we are all using our smartphones. With just a smartphone, most of us are using dual SIM smartphones. So that itself is enough. That camera is enough to take a prescription copy. So with your